Do you have pain on the side of your hip with running? I want to talk about trochanteric hip bursitis and how it typically impacts long-distance runners more than others. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist at Lewis Physical Therapy and Sports Rehab in Point Pleasant, where I've helped countless athletes and active adults get stronger and back to their sport after injury. Trochanteric hip bursitis is an inflammatory condition of the bursa on the outside of your hip, right over the greater trochanter, which if you're on the side of your hip and you find that bump, that's your greater trochanter. That bony part of your femur, there is a bursa, which is a small fluid-filled sac, which its job is to help reduce friction between the bones and soft tissues. When that bursa becomes irritated or inflamed, typically pain or discomfort will follow. And this can be due to a number of different issues. Commonly, a lot of times what I see is due to some type of weakness along the gluteal medius musculature, which ultimately is leading to some type of dynamic valgus, which is consistent knee caving in with jumping, running, and that's a combined femoral internal rotation and adduction. So how do you know if we are dealing with trochanteric bursitis? Most commonly, people report pain on the outside of their hip, especially when they're pressing right on that area, lying on that side while sleeping, or during activities like climbing stairs, or more often than not, running, jumping. Runners might feel increased pain after long runs or increased tempo intensity runs, and that hip can often feel stiff or weak as a result. And each runner is different. Some runners might feel it during their run. Some might not feel it until afterwards. So let's talk about now why long-distance runners are prone to this condition more than others. Running involves repetitive impact, which often leads to overuse, primarily in the hips, especially if there's some other issues going on that cause the hip to have excessive stress placed through them. With each stride, runners will typically generate friction over that bursa and greater trochanter, which will cause irritation of that bursal sac. Running on uneven surfaces or at an incline can sometimes exacerbate this due to the just unsteadiness in terms of the incline more than anything, or in the case if you're running on an uneven surface, or the incline for that matter is going to require you to put more force into the ground. Weakness or tightness in those hip stabilizing muscles like the gluteus medius will definitely play a role in this. It's one of the first things we evaluate on the exam. Without adequate support to that area, these muscles can, over time, get fatigued because they're weak, and as a result, that is going to strain the bursa. So if you're experiencing pain on the outer side of your hip with running, stairs, jumping, or any dynamic task like that, it's best not to push it. Typically, when this happens, it usually starts at a much lower threshold or intensity, and it can gradually build up over time to the point where it becomes more pronounced and prevalent with every stride, every jump, every step. Comment below with any questions you have on trochanteric bursitis, or text us at the number below to get a more personalized answer to your questions.